Racial wealth gaps have been a problem for as long as Boston has been a city. But in 2015, the local Federal Reserve Bank laid out all the details in a stunning report called The Color of Wealth. It found that while white households had a median net worth of more than $247,000, other racial groups had a lot less, including the infamous $8 figure for black households. But many Latino and Hispanic households weren't doing much better, including Puerto Rican families and those identified as other Hispanic, with a roughly $3,000 median net worth, or around 1% of what white households had. And as for Dominican families, it was zero. Fast forward to today, more than a year into a pandemic that has hit Latino communities particularly hard, both in terms of personal finances and personal health, as their share of the pain of COVID far exceeds their share of the population. That's where the Latino Equity Fund comes in. It was established in 2013 as the Latino Heritage Fund, first and only of its kind in the state. And now, local business leaders are launching a campaign to raise $10 million for the fund to help bridge the gap on access to health care and economic prosperity. Joined now by a co-chair of the fund's advisory committee, Juan Lopera. He's the incoming Chief of Diversity, Equity, and Inclusion Officer at Beth Isreal Lahey Health, Dr. Joseph Betancourt, who's now joining the committee. He's also the Senior Vice President for Equity and Community Health and Senior Advisor to the Disparities Solutions Center at Mass General and an Associate Professor of Medicine at Harvard Medical School. Juan, Doctor, thank you so much for being with me.
Great to be with you.
Juan, if I can start with you. When announcing the campaign, the press release quotes you saying, COVID-19 was our reckoning. What does that mean?
Yeah, for the Latino community, we have seen the impact across the board, and every metric you look at, the COVID cases for the Latino community, one of the highest, the hospitalization rate, the age-adjusted death rate, and then the economic impact disproportionately also impacting Latino-owned businesses. So it was quite the rude awakening, and much of it really stemming from systemic issues that have plagued our community for so long.
Juan, starting with you for a minute, Latino growth in the population in Boston has accounted for more than 90% of the total growth of Boston population over the last 40 years. But there's no commensurate growth in political power, in tangible progress in the Latino community. Why that disconnect?
Yeah, the reality is we just have not had, we haven't had the representation we need. We have not come together as a community as much as we need. And we just haven't had enough people in power roles. But that is changing. That is changing with the Latino Equity Fund. That's changing with organizations like Amplify Latinx. And so I think we are being heard finally.
Doctor, I want to return to what Juan was talking about, some of these statistics, which I'm sure you know far better and more painfully than I am. Just put up from the Mass Department of Public Health, mass COVID cases as a percentage of 100,000 population numbers, and deaths. I'm sure you've seen this. Whites are 71% of the population, 25% of the deaths, only 12% of the cases. Hispanic, as they're listed by the Department of Public Health, only 12% of the population, yet 38% of the cases and 17% of the deaths. Are we making progress on that front? That's from May 12th, by the way. Are we making progress there, Doctor?
We certainly are, and I'd say that for both Juan and I, both individuals who are Latino, dedicated to these issues. We've been in the fight since day one. I think, the numbers are easy to explain. Our community is young, vibrant, hardworking, essential workers. And so the case rates that we saw, I think we fully expected. They were in the eye of a perfect storm for the spread of COVID-19. And, as you look at their death rate, certainly lower than the case rate. We tend to be younger. We are disproportionately impacted by chronic diseases that put us at higher risk for higher mortality. Nevertheless, I think we were hit early, we were hit hard, but it is getting better, Jim. And I think we're really working hard now on turning the corner and getting towards vaccination. That to us is our path towards normal. And that's going to take, some hard work that we're engaged in right now.
On the vaccination front, though, Doctor, is hesitancy the issue, access the issue, or is it both?
I'd like to say that it's a three-legged stool as we think about vaccine equity. So number one, you want people to know that the vaccine is available, where it's available, and for them to understand that there aren't barriers like needing identification, needing to pay for the vaccine and the like. So that's one leg of the stool. The second leg is facilitating scheduling and availability. So once people know that it's available and they know that they can go and get it done, what are the ways in which we facilitate scheduling? So, early on, we were using our patient gateway, our electronic medical record. You needed to get on the computer. Certainly, as with the digital divide, we knew that our communities were limited in their ability to do that. So facilitating simple, easy ways. Now we're going to even walk-in. That is the second key leg of the stool. And the third is building confidence in the vaccine, addressing mistrust, misconceptions. But I'd like to highlight that, without any one of those legs, the stool falls over. We could do all the work on confidence that we want in hesitancy. If it's not available, if people don't know how to get it, that's a problem. And the cycle goes on. So we need to work on all three of those areas.
Juan, and I know that you were part of the effort to shore up at least one of those legs with this mobile vax thing. How is that working?
Yeah, so it as part of my previous capacity under Tufts Health Plan Harvard Pilgrim, a collaboration came together that included two Latino-owned companies. One is DPV Transportation, the other one is ASG Marketing. They do multicultural marketing. And we brought that group together really through the connections of the Latino Equity Fund, where one of our members is a financial advisor to both of those companies. Both of the companies were really struggling financially during the pandemic. So we were able to do both address health equity and economic inclusion through this initiative. And the way we went about it really falls in line with what Dr. Betancourt was mentioning. With ASG, we did door-to-door, boots on the ground, information in language in a culturally competent way. And with DPV Transportation, they were able to re-engineer their vehicles, which were being used for other purposes, such as at the casino. They used them as mobile vaccination units. And we partner with the East Boston Neighborhood Health Center to get the vaccine and to get the vaccinators. So it was a great win-win for the community, where we brought the vaccine to people. We didn't wait for them to come and stand in line and take time off from work to do so. We needed to bring the vaccine to them.
Doctor, a couple of years ago, a study came out that was one of the most shocking I'd ever seen in medicine, talking about white residents and the stereotypes they had about black patients. Their skin was thicker. They were more resistant to pain, things that just stunning. Is there any of that stereotyping in terms of service for the Latino community in healthcare facilities?
Yeah, I think, I've been doing this work for more than 20 years in this area of health disparities. And, these assumptions that we make about people do play out. And these stereotypes have been propagated over years, even in medical education. And so, absolutely. I think we need to understand that as human beings, we make assumptions about people, the less we understand about them. And oftentimes with people of color, those assumptions tend to be negative. And that does play out in communications and decision-making and resource distribution. And so, I think one stereotype that we'd like to break about the Latino community is this is a community that is strong, is resilient. And whereas we want to bring mobile and bring it to people, our communities are very strong. They get all around every day. And so this is meeting people where they are, but also understanding that they have agency. They have, capacities that allow them to be, a key part of our fabric that got us through the pandemic as essential workers throughout this last year.
Yeah, Juan, I only have 30 seconds left, but I assume part of your focus is on undocumented workers who in many ways have it even worse than what we've been talking about. Is that correct?
Yeah, no, I think the outreach that has been done is very attuned to that, making sure that when we engage in the community, we're using people from the community so that they are trusted sources, and we don't ask for documentation. We welcome everyone as part of the groups.
Well, I wish you both luck in your work, particularly with the Latino Equity Fund. Good luck to both of you, and thank you both so much for your time tonight.
Thank you for having us.